Good day, I am Jazen May Elamusa, a student nurse of Southwestern University. So today I am going to perform administering an intradermal injection or skin test. The purpose of this is to provide a medication that the client requires for allergy testing and TB screening. So before we proceed to the procedure, we should have the equipments that needed for the administering intradermal injection for skin test. So we should have syringe, syringe which measures 1 ml. This is a tuberculin syringe, and we have alcohol swab, alcohol swab, and a sterile water for the skin test. I am using a sterile water for the skin test, and also we should have clean gloves or a sterile gloves for the medication for the administering intradermal injection. And also we should have a medical card which contains the name of the patient, the correct frequency, the dose, and the correct medication of the patient. For the preparation of this procedure, we should check first the MAR of the medication administration record, and check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. And also follow the 3 checks of administering medications and read the label on the medication. First is when it is taken from the medication card, and second is before withdrawing the medication, and third is after withdrawing the medication, and organize the equipment to be given. Before we proceed to our intradermal injection for skin test, is we should perform hand hygiene and observe other appropriate infection prevention procedures. So now for now we are going to prepare the medication from the vial or ampule for drug withdrawal. As for now, we are going to use a distilled water or sterile water for injection. So now I am going to withdraw the sterile water from the injection, from the syringe. So we're going to the measurement that we'll be needing for this skin test is approximately 0.1 ml. So we're going to inject the syringe, and then we're going to get the 0.1 ml. So that's so after we withdraw the sterile water, is we're going to put it back and in the bottle, in the cup of the injection, and then the syringe. Withdraw the medication is we should prepare the client, and prior to the performing the procedure, I will introduce myself and verify the client's identity using the agency protocol. So this will ensure the right client that receives the medication. Sir?
Yes.
Next is explain to the client that the medication will produce a small wheal, sometimes called a bleb. A wheal is a small raised area like a blister the client will feel a slight prick as the needle enters the skin, and some medications are absorbed slowly through the capillaries into the general circulation, and the bleed gradually disappears. Other drugs remain in the area and interact with the body tissues to produce redness and induration or hardening, which will need to be interpreted at a particular time, and this reaction will also gradually disappear. So provide for client privacy. Select a clean the site. Select a site from the patient, like the forearm. In the forearm, avoid using sites that are tender or inflamed or swollen and those that have lesions. So for this client, there have no lesions or inflamed or swollen. So after this, we are going to apply gloves as indicated by agency policy. Alcohol swab. Cleanse the skin at the side using a firm circular motion starting at the center and a widening circle outward, and allow the area to dry thoroughly. After the area is dry, prepare the syringe for the injection. And remove the needle cap while waiting for the antiseptic to dry. Expel any air bubbles from the syringe. Small bubbles that adhere the plunger area or no consequence, because rationale for this is a small amount of air will not harm the tissue. Grasp the syringe in your dominant hand and close to the hub, holding it between the thumb and forefinger. Hold the needle almost parallel to the skin surface. With the bevel of the needle up. Next is inject the fluid. With the non-dominant hand, pull the skin at the side until it's taut. And insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. The outline of the bevel should be visible under the skin surface. Wait until 5 seconds to stabilize the syringe and needle. Inject the medications carefully and slowly so that it produces a small wheal on the skin. Withdraw the needle quickly at the same angle at which it was inserted. Activate the needle safety device. And apply a bandage if indicated. Do not massage the area and dispose the syringe and needle into the sharp container. Remove and discard the gloves. Perform hand hygiene after the injection. And after that, circle the injection site with the ink to observe for redness or induration per agency policy. Document all relevant information. Record the testing material given the time, dosage, route, site, and nursing assessment. Evaluate the client's response to the testing substance and evaluate the condition of the site in 24 to 48 hours depending on the test. Measure the area for redness and induration in millimeters at the largest diameter and document findings. So that's it for the intradermal injection for skin test.